We're here in our office at Montgomery, Cincinnati Sports Medicine Orthopedic Center, and I have a very pleasant patient here, Diane, and I'm just seeing Diane for the first time, and she's been nice enough to give me permission to record my conversation with her. And Diane is 53, and she had a medial meniscectomy over 8 years ago, I think in 1999.
Yeah, correct.
And you did well for a while, but now you've noticed in the past 5 or 6 or 7 years you're getting more and more pain. And we talked beforehand, and you can still go about a mile, and 45 minutes of walking, you start to have pain, don't you?
Correct.
And Diane's pain is very much on the inside part of her knee, and I've shown her the x-rays, and this is down to bone. And so we have bone-on-bone changes here, and Diane knows that she is headed for a knee replacement. So I'm going to kind of show you what we do to prepare a patient for a knee replacement. And Diane, we also talked, because of your bow leg, when you walk, you're putting all your pressure on the inside. And you can feel that, can't you?
Yep.
You can feel kind of that thrusting motion, and we've kind of pointed that out to you. Now, Diane works in a pediatric office, and she's young for a knee replacement, so we're going to try to buy a little bit more time. But we've also, using medical treatment, but we've also advised you that you're probably coming close. And I told you, if you remember, that you'll tell me. I'll do the same operation on you now or in a year or two. So many patients ask me, do I have to jump into this? And the answer is no. And so we kind of want to take little baby steps.
Right.
And so we're going to try some medical treatment, and we've talked about using cortisone in the joint, and that way we can put strong medication into your joint for a period of 3 months, and that can really help you, and then you kind of save your stomach. And so you use Advil or Tylenol, and that's a very nice way for patients so that they're not loaded up on all of these other medications. And then after that we're going to use Synvisc, which is a lubricant, and we think that'll buy you some time. And then you're going to get ready by going to therapy and keeping strong and keeping your muscles so you don't get atrophy. So that's another part of your treatment.
Okay.
And are you up on your feet very much in your job?
Not in my job, no.
Not much. And you like to walk?
I like to walk. I go to the gym. I swim.
Good. Now we really like
spin.
that. We really like that. And one of the things I need to advise you of is that sometimes you get more sedentary and people will put on 15, 20 pounds. And for every pound you weigh, you put 4 pounds on the knee joint. And so you can actually start getting worse. And then when you have surgery, if you don't have good nutrition, you'll actually gain weight from surgery. So I'm glad to hear that you go to the gym. And our therapist will work with you, and they'll give you a whole bunch of exercises and see what you're doing. But they'll also want to make sure you're not doing some things that irritate your knee.
Right.
Okay, so that sounds like a good medical treatment for a while.